Good morning, everyone. Thank you for joining us for the Susan G. Komen, Michigan Grant Writers Applicant Workshop. Today we will be going over the requirements for application, the practical GEMS steps that you'll go through to submit it. We'll also be talking a bit about our community profile and the priorities that came from that. Um, so, to begin, we're going to start with, um, let's see, there we go. So, I am Megan Smith Jovanovic. I'm the mission director for Susan G. Komen, Michigan. We currently cover 20, soon to be have formally covered 24 counties in lower Michigan. We grant regionally by 3 different service areas. And we recently just went through a merger of 3 different affiliates in January of 2015. So if you have questions about grants, I'm the person to call. Nicole Milliman is also on our team. She is our grants and mission coordinator, and she's also available for assistance when you need it. So today we're going to go over a few introductions, some background. We're going to talk about the community profile, go through the elements of the request for applications, and then we'll finish up with a GEMS tutorial. I appreciate all of you watching through so that you get a refresh of all the different elements for our grant cycle, as well as the GEMS elements. So thank you all for being here today and listening in. So the goals, we want to familiarize yourself with Susan G. Komen. We want to inform applicants about the funding opportunities. We want to help you to be successful in the development of your application. And we also want to encourage you to consider networking with other breast health professionals who are also looking for funding, because we love to see collaboration between programs. So the vision of Susan G. Komen is a world without breast cancer. And our promise started more than 30 years ago from one sister to another, that she would do everything in her power to end breast cancer forever. So Susan G. Komen promises to save lives and end breast cancer forever by empowering people, ensuring quality care for all, and energizing science to find the cures. Our community profile was completed in 2015, early 2016. The data from the community profile should be used in your statement of need. In the RFA, I included a short summary of certain elements of our community profile that led to the selection of our priorities. I'd encourage you to read that closely. I'd also encourage you to read the executive summary and the entire community profile, or at least flip through it and find the sections that most closely identify with your program. The community profile is a needs assessment that forms the foundation of all of our grant making. We start by looking at the need, identifying priorities, and then we grant to meet those priorities. So it's really an important document for you to utilize, particularly in your statement of need. In that document, you'll notice that we selected specific populations: African Americans, Hispanic Latinas, and rural populations all have access issues, as well as issues throughout the continuum of care that lead to disparities in outcomes. So those are populations that we're particularly interested in. Within those populations, we selected specific counties that had particularly poor indicators to do a deeper dive and study of how we can address breast cancer in those populations. So you'll see that there's 9 specific counties listed for the 3 specific populations. That's not to say that your program cannot be funded if you serve a population elsewhere. It just means that you have to satisfy a very strong justification in your statement of need to justify your program. So if you're focusing on, for instance, serving African Americans, but it's not in one of those 3 counties, tell us about the cancer burden of African Americans in your county. In the community profile, there will be data contained for those populations. And then there's additionally a secondary state of Michigan community profile that has quantitative data for all of the counties across Michigan. So there might be additional data in that document that you should pull as well. But the emphasis here is use this document to help justify your program. It's the document that's going to be guiding our grant reviewers. It's the document that guides our grant making, and it really provides a strong foundation for why our priorities are where they are. So make sure that you're taking the time to review that and using those as resources to build a very strong statement of need. If you work outside of those priority areas, just again, make sure that you're identifying the need and how your program will fit with the other resources in your community to fill those gaps. So as you read through the community profile, you'll see that we focus on the cancer burden data, incidence, mortality, late stage diagnosis. Then we look at the health systems and the public policy available. So if you don't have major health systems in the rural area you serve, that's a very compelling fact that you want to include in your statement of need to help lay the groundwork for what your community looks like and how you are going to address that need. Our grant reviewers are very interested in this element, so make sure that you use that community profile to your benefit. So from our community profile, we identified 3 funding priorities: screening, community-based navigation, and survivorship support. You'll notice that the community profile got a lot more specific this year about different elements that we would love to see in all of these programs. Please consider how you can adopt these to work in your communities with your programs. Again, at the bottom, you'll see that we identify those target populations. Those are focuses for us, but again, it's not to say that we won't grant outside those focuses. It's to say that you have to very strongly justify the need and how you'll meet that. So I'm not going to read to you because I always hate when people do that on webinars. Again, this is contained within the RFA, and immediately preceding it is information that supports it in our community profile. So the second priority, and these are ranked priorities, the second priority, even though it says number 1 on the screen, is culturally appropriate education and community navigation. One of the things that we recognized through the community profile work that we did was that our landscape of opportunities and resources for breast health screening has increased. The caseload of breast and cervical has been able to be expanded to include more services than ever. A number of women who our program served year after year for a number of years now have access to other health care options like the Healthy Michigan Plan, expanded Medicaid, breast and cervical program, and other options that have allowed our focus to shift to those women who are rarely and never screened, to those women who are not well connected to our healthcare system, to those women who need a little bit more education and support to be able to get in for appointments, focusing a little bit more on making and keeping appointments rather than necessarily paying for services. So you'll notice that in this priority, again, we have elements that are very much community-based. We are aligning ourselves with the state innovation model that asks us to bring healthcare into our communities, and this priority is very much focused on that. So the community-based navigation, the idea is to provide a connection point between the community where women live and the services in our healthcare systems to support a transition into screening as well as through any necessary follow-up services. Those programs should be focused on reducing barriers and providing evidence-based education. We've noticed that there's a lot of myths and there's a lot of fear associated with breast health in some of our communities, particularly Hispanic, Latina, and African American communities. And we recognize that we need to address those issues first. So we want to support programs that support, sending people in the community to help educate and connect people back to services. So we want to make sure that there's good education. We want to make sure that there's good connection to services and support and transition to any necessary follow-up navigation or diagnostics, for diagnostics. And again, we have target populations, but there's very much a strong ability to support the need for these programs across our service area. So we're looking forward to seeing innovative program designs that will help tie our community into the service options that we have. A great resource for looking at some evidence-based interventions is the Community Toolbox, and I will make a note to put that on the grantee resources page as well. The final priority is survivorship. We recognize that there's a number of wellness and lifestyle interventions that can help reduce the risk of recurrence for survivors and we particularly love to fund programs that use those evidence-based interventions. So, for example, programs that focus on social emotional well-being, programs that incorporate yoga or other exercise programs for survivors, programs that incorporate healthy eating to help women learn how to cook in a healthier way. If your doctor says, you know, we really want you to eat more green leafy vegetables and whole grains, and here's some quinoa for you to try, but you've never cooked quinoa, it's a good opportunity for education about making choices that'll support a reduced risk of recurrence. Again, we do have target populations. However, we recognize in the community profile across our service area, there often are very much a dearth of quality survivorship programs. So that's our final priority for community grants. So what are some of the changes for 2017 to 2018? Well, we have a new community profile. Use it. It took us a lot of work to put that together, and it's a document that we are utilizing to guide us into the future. So we want you to join us and align with us to meet those priorities. We updated our priorities with some essential elements for programs to help strengthen the best practices that we have seen across our grant programs and hopefully help to better connect our programs throughout the continuum of care. Our funding request maximum is set at $75,000. We have a new reporting Excel file for progress and final reports that will accompany your GEMS reports. They'll be submitted via email along with your success story and release. And that document has 3 tabs to it. The first one mirrors exactly the GEMS reporting that you'll be doing, just for the individual served table, if you're familiar with that as a former grantee. The second page looks at specific markers that we believe do a better job of telling people what we're doing in the community, you know, looking at the lives that we're impacting, the number of people who are getting services, rather than just counting services or dollars. And that will be available on the grantee resource or the applicant resource page as well, and the links to that are in the RFA and also at the end of this presentation. Our applicants, as we have in years past, must clearly address how your program ties into the Breast and Cervical Cancer Control and Navigation Program, Healthy Michigan program. Both of those programs are excellent resources that we need to take advantage of so that Komen funding is not duplicative. We really see a big opportunity for Komen to help become a leverage point to help utilize those programs even better by educating people in the community, getting them in for services, and helping support them throughout the continuum of care. So make sure that you address directly how your program ties in and how you refer to these other programs, because those are critical partners for particularly all of our services programs. We are continuing to emphasize how important success stories are, so we'll talk a little bit more about that later in this presentation. But we find that numbers and dollar amounts don't mean as much as the personal stories of how people's lives have been helped by your programs. By the work that we do in the community, we're really able to impact. It's really more about individuals, so we're focusing more on those individual stories. As you will notice, our regional granting RFA has been released. We have 3 RFAs. The first is for Mid-Michigan, including those counties. The second is for Southwest Michigan, and the third is for West Michigan. When you are in GEMS, our grant-making system, you will notice that RFA A might not have an A next to it. It might just be RFA 2017, and you'll know that that's code for Mid-Michigan. So as you're initiating your application, which again we'll go through the steps later in this presentation, just make sure that you're selecting the right community, because I don't know if I'm able to port applications between, so you might have to refill everything in the correct opportunity. So let's talk a little bit about success stories. We've started a strong focus on success stories a few years ago, and I want to just briefly touch on why that's so important. What we found is that it helps educate the community to know that your resources, the resources that we support, are even available. A lot of women in our focus groups during the community profile expressed frustration at some of their friends who take a fatalist approach to breast health, who say, well, I mean, what am I even going to do? How am I going to pay for that? What would I even do if it was something? Well, there's resources available. There's testing, there's funding, there's navigation support that all of your programs provide that can help women get the help they need. So we want to educate people that these resources are available. We also want to encourage women and men to see themselves in these stories, to identify that, oh, maybe I should go get my mammogram, or maybe that is a program that might support my survivorship because I could use a little bit of support right now. So we want to encourage others to access services. And we also want to inspire our donors to show the impacts of the programs that they're supporting. We want people to understand how they're able to help the individuals in their community right here. The idea that racing for the cure in your local community actually means helping the woman down the street that needs a little bit of assistance getting her mammogram. Those are the types of stories, those are the types of reasons and the purposes for these stories. So I'm going to go over reporting a little bit. You'll notice that success stories are woven throughout this. Our monthly email updates will talk about 4 things. Very brief sentences. It can often be just 4 sentences. Talking about your successes and your program progress to make sure that you're on track. Discussing any challenges or changes. For instance, if you have we need to be notified if you have personnel changes or other key changes to the program. This monthly email gives us the opportunity to have that conversation if we have not already, to identify if we need to do modifications or anything in the future. We also like to know about your upcoming events. We like to publicize them. We like to go to them. We like to support them. So we'd love to know about any of those related to breast health. And then the last question is about our final success story requirement. When we come and visit you for site visits, usually in November, we ask that you bring someone who's been impacted by your program so that we can film video with them and create videos that help people understand what we do. So the last question in those monthly emails is, how's that site visit video coming? How are you doing finding someone who might be willing to share their story on film? At midterm reports, we do a short story in the GEMS reporting field. We do a longer story, and we ask that you send a release if we have patient identifiable information in there so that we can contact the person directly. And then we also do a video filmed at your site visit, or if you have a program event, if you have a program day, if you have something going on that might be a great opportunity for us to grab some video, please invite me to come. I went to Grass Lake Sanctuary a couple of weeks ago for their final survivor retreat, and it was incredibly powerful. They invited me to sit through their final circle of where they shared what they were taking away from this weekend, and then women were invited to come and talk with me about what it meant and what the weekend offered them. And 5 women volunteered to come and sit down with me and shared really beautiful things about how they felt so much support and kind of an awakening within themselves for self-care and for their future. So that was a really great opportunity. It's not the site visit, but it was a great opportunity for me to come out, and we welcome those opportunities as well. And then that Excel report that we talked about on the last slide that includes some key reporting elements. At final reports, at the end of the grant term, we again do a short story in GEMS. We do a longer story with release outside of GEMS, and then that final Excel report. So as you'll see, we've woven story support and the opportunity to have conversations throughout. At our grantee orientation, we take an opportunity to have all of our grantees share some of the things that they've done to incorporate story collection into their process, and some of the things that they found successful in their approaches. So I'll share a few of those with you today. So here's an example success story. Casting for Recovery does fly fishing retreats, and they've been on hiatus in Michigan since 2007. Komen, Michigan provided small grant funding to them in order for them to bring a program to Michigan for the first time this year in a number of years. So we provided funding for women from our 3 different service areas to attend. They had women from across the state as well, and they had a really beautiful weekend a couple weekends ago. So this is one of the stories that they sent me. Ellen was scared of the water. She doesn't know how to swim and had never had a fly rod in her hand before. By the end of the fishing day, she was in the middle of the river doing 30-foot casts. She stated that she's officially an angler and she's seriously taking up the sport. She said repeatedly she did not want to get out of the river. This highlights the inspiration that some of our programs can provide for women to adopt healthy lifestyles, like active lifestyles. So, just a really short story. It talks a little bit about Ellen and what she was like before this experience. It talks about what the experience did for her, and then it talks about the future and how the Komen program helped her find resolution or peace. Um, so that's a good example, and then they also provided a photo. So, best practices for story collection. These are some of the things that we've gathered from grantees at our grantee orientation this past year. One of the things that came across was it's important to provide multiple opportunities for women to share their story because they're often in crisis. They might not feel comfortable at different points throughout their journey, but that's really, you should provide the opportunity for the women to decide when, if and when it's right. So some of our grantees incorporate a little statement on their enrollment forms that say your services may be paid in part by Komen Michigan funding. If you're interested in sharing your story, please let us know or go to this website. And at the bottom of this page, you can see that I have a link to a Komen Michigan landing page where women can enter their information directly, which then circumvents any HIPAA issues. So they're self-reporting their stories. You can also mention it during service provision if you're having a conversation with a woman about, the fact that Komen funds might be able to help her bridge this financial gap that she has. Make the mention that, and if you feel compelled to share your story, Komen always loves to hear from participants. And then upon completion, some of our grantees, that last visit or whenever their session is over, they again offer the opportunity to share stories. And some in a separate letter, even outside of their evaluation envelopes, will send a letter providing an opportunity for feedback for how the program helped them. We've found that some women prefer to handwrite their stories. Some women prefer just to tell it to the program director who then writes it up for us. Other women prefer to contact us directly, and some are willing to do a video as well. So those are all great opportunities, but I would encourage you to consider how you can weave in story collection into your program. We'll also have a template for story collection that's available online, and I'll also link to a website that talks about some best practices for story collection. So here's some important dates to go over. You're doing the grantee workshop right now. Thank you for being a part of it. Our application should be available in GEMS about September 12th. The initiation deadline, so this is the day by which you should start your application, is October 14th. And then you have to submit it by the following Friday. As many of our grantees know, GEMS can be a tricky system. Our application requires a lot of different elements, and I want everyone to have the time to get into GEMS and make sure that you have a handle on it before submission. So please initiate by the 14th. You could even do it as soon as it's available in GEMS, and then submission deadline is October 21st at 5 p.m. If there's any issues with your application, I will be reading through all of them in the next week, and if I identify any issues or questions or things that are problematic, I will, if it's possible, I will give you a conditional cure period of 24 hours, and you'll get an email and probably a phone call to discuss the issue, identify what needs to be done, and then you'll have the opportunity to make those changes in GEMS. Everything has to be done by November 1st because that's when my grant reviewers get all of your applications. So grant review goes throughout the month of November. Grant review committees all meet in December, and then the slate goes to the board in January, and the funding line is drawn usually in February. So usually sometime February, maybe early March, I will have award notification out for those programs that have been approved and have been funded. The way that we fund programs, our grant review committee reviews and scores and creates a final ranking, a slate of grants for each of our 3 service areas. And then as much money as we have fundraised in each of those areas, we go down the list of grants and we fund as far as we can. Once the money is out, then we stop funding. So it is possible that your program would be approved, but we would not have funding available. So just so that you're aware, the application or the award notification rather will be probably in February or March. The contracts, as soon as I have them set up in GEMS, we expect you to complete that within 30 days. You'll note that one of the appendix of your RFA is a copy of the contract. Please, if you are in a large institution, and even if you aren't, take a moment and forward that to your legal folks who would need to review the contract so that they have a moment to review it now and identify any potential problems. Because we really don't want to get to day 21 of you needing to complete the contract before we realize that we need to talk about something and we need to come up with a solution. So we want to have those conversations the first week of contracts so we can sort things out, get everything together and completed so we can get payments made. The award period is from April 1st to March 31st, 2018. We will have a mandatory orientation in April or May 2017. Usually we do a webinar orientation and then we also do an in-person one, which is not mandatory, but it's strongly encouraged that if you can attend, please do. They are often a really fantastic opportunity to meet other grantees, to learn from each other, to talk about some of the things that are going really well for your programs, and to glean some ideas for some of the challenges that you might have. The payments will be made. We'll request checks upon contract acceptance. It takes about 2 weeks to process, so those are usually arrive in the mail to you early April. So, eligibility, got to be a nonprofit organization or a state or local agency or a tribe. All past and current Komen-funded grants should be in compliance and up to date. Your programs have to be related to breast health. So, for instance, if you are a breast and cervical program and you want to fund a position, ask us for the portion of your caseload that is breast health and identify alternative funding sources for the cervical portion. If you're doing a symposium on all types of cancers, ask us for the funding for the breast cancer portion. Our grant reviewers are very particular about this, as are our donors. We're really focused specifically on breast health, so make sure that your programs tie in very strongly to that and that your requests reflect that. You must be located in or providing services to one of our service areas. We have 3 separate service areas. If you cross service areas, give me a call to discuss. Because we have 3 separate grant fund pots and 3 separate grant review committees, the reality is that there might need to be more than one application and that one might be funded and the other not. So unfortunately, that's just the way it is, but I want to talk with you about that and see if there's a way that we can make it work for your program. Here are our service areas. You'll notice that we have a few new counties. Added to West Michigan is now Mecosta County. Added to Mid-Michigan is Barry, Hillsdale, and Ionia. So that brings our total coverage area to 24 counties. Again, this is all listed in the RFA in case you want to write that down. So your program description, your application, these are the elements that we will be these are the review elements for and they're also your program design elements. So what's really nice about the revised scoring process for us is that the elements that you're writing about are directly scored, which is a nice match to have. So you'll notice that these are weighted a little bit differently. Statement of need, again, as I mentioned, is very important. Your project design is very important, and how you tie into other components and how you support women throughout the continuum of care are the 3 biggest elements there. We also, of course, have, the other elements are important, but those are weighted more heavily. So make sure that you're paying very much attention to the questions and the suggestions that are outlined in the RFA. For your budget, your funds can be used for all of these things. We do allow funds to be used for salaries. Historically, Komen grant review committees are very harsh on salaries and want a very strong justification. As we went through our priorities priority number 1 and 2 and 3 all require people to run those programs. So outline why the positions that you're requesting funding for are critical to your program. Outline the elements that those positions will be taking care of, and outline why it's so critical to your program design to have the funding for these people. Particularly, the second objective is all focused on community-based navigation. Those are people, so that should be strongly justified in your budget section and throughout your program design. Our grant reviewers should have no question about why this person needs to be a part of this program, why Komen needs to fund it, and why they're being compensated at that level. And it's often just as simple as saying, these are the standards of the industry, these are the critical components of the program that this person will carry out, and this is why we need to fund them. So if you do a percentage, for instance, of program time, make sure that you're breaking down the hours that the person is spending on this project. I have no doubt that there are many hours that go into this project. So just provide strong justification, and I believe that our grant review committee will understand the need for the salary allocations. So the rest of these areas I think are pretty self-explanatory. We can do equipment, but not beyond $5,000. And equipment, again, provides strong justification for that area as well. We do provide for indirect costs up to 15% of the allocated expenses. We cannot fund medical or scientific research. However, program evaluation is not medical or scientific research, at least not according to the definitions of Komen. If this is a concern, please call me and we will have a discussion about what your proposal is and how it fits in. I absolutely want program evaluation. We just have to make sure that we're on the right side of the line there. We don't do media projects. There's a number of other restrictions. Educational material, Komen materials should be used. We can't fund the creation of educational material because that's something that's done at an HQ level. Komen materials are available free for download as PDFs on Komen.org. As a grantee, you get a discount for Shop Komen printed materials if you'd like. So please utilize those resources, look at those resources. If you want to use a material from a different program as a part of yours, that needs to be approved ahead of time. Often I can do the approval. Sometimes it requires going up to HQ. So again, if that's a concern, let's have a discussion about it. Finally, I want to take just a minute to talk about breast self-exam instruction and models. Komen does not fund breast self-exam instruction or models. We are prohibited from funding it. And it goes back to the Shanghai study that was completed in 2002. It involved over 200,000 women, and it found that breast self-exam instruction and models were not saving women's lives. So in 2008, Komen made the shift to breast self-awareness messaging instead, to encourage women to know the normal look and feel of their breasts, to talk to their doctor about any changes, rather than the specific placement of a hand on the spokes around a pinwheel. So Komen has transitioned to breast self-awareness. All of our educational material incorporates this messaging. We cannot fund breast self-exam models, any of that. So just to be clear on that, if you have more questions, I love geeking out and talking about the Shanghai study because I think it's really interesting what they found there. So if you ever want to have a discussion, I am available for that as well. So supporting documentation, please identify your key personnel, provide them with the job descriptions, proof of nonprofit status. We also strongly encourage letters of support from collaborating agencies. We really like to see how y'all are going to work together and that people are willing to sign their name on the dotted line to say, yes, we will work together. Also include any evaluation forms. Your proof of liability insurance must be provided at the contracting stage. That's a good discussion to start now as well, because often those terms can be tricky for self-insured institutions. But you must list Komen, Michigan and Komen HQ as an additional insured as part of our contract process. So our application compliance review will happen the week after you submit. You will have 48 hours to correct the problem. One of the areas that we will be much more picky on this year is making sure that all objectives are SMART objectives. As part of the appendixes to the RFA, there is a SMART objective guide. Use that. Also, go online. There's some great worksheets. There's some good tutorials that can help you really drill down to what very specifically are we going to measure to show the impact of our program. Again, we went over the selection criteria and how it's weighted. There is a set of questions in each section of these in the RFA, and you'll also be able to see the questions that grant reviewers are going to be asking themselves when they're scoring each of these sections. So take a look at those and make sure that you're addressing all of those questions. Grant reviewers, if they're curious about progress, may be provided the last 2 recent GEMS reports as well. So if you need any help, give me a call, send me an email, and we'll make sure that we get the answers. There's also a lot of great resources posted to the How to Apply for Grant section of the Komen, Michigan webpage, and I will show you how to access that right now. So when you go to our Komen webpage, underneath Community Impact, go to How to Apply for Community Grants, and here's all the grant information. So you'll see that the community profile links are on this page, the RFAs are on this page, important dates, the link to this webinar, and then eventually down at the bottom we'll include the applicant training. And on the side here, you'll also see that there's a tab that says Resources for Grant Applicants. That's another area where you can find the community profiles, the link to GEMS, and the user guides. So those are 2 great resources for you. Let's see. Do we have any questions about this section so far? We'll, oops. The deadlines, here, we'll just make this big. So initiate by Friday, October 14th, and submit by the 21st. I'm going to see if there's any questions. Otherwise, we'll go on to the next presentation about GEMS. Okay, so GEMS is our Komen Grants e-management system, also known as GEMS. We moved to online grants to reduce paperwork, to provide a centralized location, to help with evaluation, and in the hopes of being able to aggregate our data nationally to say, Komen, as an organization, did this much of this thing this year. In GEMS, you must have 2 users, usually the project director and the authorized signer. You can have additional users if you need. You can have multiple authorized signers, multiple project directors. They each have different levels of access in GEMS. Project directors have the most level of access. They can edit, delete, change things, submit. Actually, they can do everything but submit. The authorized signer can review, edit, and submit. So your organization must have 2 of these. The way to do this is to have your project director register first, and I will approve the project director, and then your authorized signer will register, and your project director can actually approve them. But I can also help with that step if need be. Additionally, you can have viewers who are able to see everything that's in there, but they won't be able to save, add, edit, or change. Writers will be able to save, add, edit, or change, but can't do pretty much anything else. So they can't change status, and they cannot submit. If you have a grant writer, for instance, this might be a good role for them to be able to get in there. To register for GEMS, you will go to the login page, and at the bottom left side there, you can see where that arrow is, that there's a Register Now button. The registration page is one of the trickiest and most frustrating parts of GEMS. That pink Go button is the trick. So you'll see that there's lots of arrows pointing to those pink Go buttons. It's because they're very important. So fill out your name, your contact info. When you get to what is your position at the affiliate, you're an applicant. Once you select that from the drop-down, hit that pink Go button. The next thing you'll do, you'll be able to select your state from the drop-down, and then again, hit that pink Go button. Once you do that, the that affiliate blank there will auto-populate. So if you don't hit that pink Go button, you're not going to be able to select any of that. Once the affiliate pops open, it should be listed as Komen, Michigan, MI 101. I hope. We just merged all the systems last month, so I really hope it shows up like that. It should, if it otherwise, it would say West Michigan. If you were previously a grantee, you should still be able to log in, and now you will be logging into our combined system. If you have any trouble with this, please let me know. We're still working through the kinks of merging the systems, but it should be just fine. Once you select the Komen, Michigan affiliate, you'll be able to select your organization from the drop-down. If you notice that there is more than one of your organization listed, please let me know, and I will do some digging so that we can figure out which one you want to put your large grant application in. Some of our grantees, because of merging the systems, might have more than one login. So if that's the case, please let me know. And then you choose a username and password and hit the save button at the top. Once the project director registers, I'll get an email, but sometimes those emails don't take a long time to get to me. So feel free to shoot me a quick message that said, hey, I'm a new user, I just registered, can you please approve me? And I'll jump in the system and get that taken care of. Your authorized signer will then go through this entire process as well and hit the save button. And now that you've been approved as a project director, you'll be able to approve them. Oh, this is what the registration page looks like. If you're a new organization, you'll be able to fill out all that information. You can also update this later if need be. So you will have 2 emails that you get as part of registration. One will be that it's submitted. One will be that you have access granted. Again, if it takes a minute, and you feel free to send me a message if it's taking too long to get you approved. So I will approve project directors, and then the project director can approve other users. So when you log on to GEMS, at the top of the page, there's a little icon that says My Profile, and then there's a little icon next to it that says My Administration. As a project director, you open up that My Administration page, and there is one option for you. It is Project Director User Approval. Once you open that up, this is what the page looks like. I find it's easiest in GEMS to use the least amount of information in searches as possible. So do the person's last name, do the person's first name, or just do the state and hit search. Less information is generally better for GEMS searches. So once you find the person, hit that little box right next to their name and approve them as whatever role you want to set them to. You can also set active and inactive dates. So for instance, if you have an intern who'll be working with you for a few months on this project, perhaps you only give them temporary access to it. So here's your home page. Again, at the top in that dark pink bar, you can see the My Administration section. This is what your home page will look like. The first section there is View Available Proposals, and that's where you will initiate the application. My inbox has messages in it. I haven't found that to be less useful. My tasks often will link directly to the application you're working on, but not always. I've found it's not always reliable. So the way that I always find applications after I initiate them is to click up at the top at the My CG Applications and search for the year. So to initiate applications, you'll go to that first option on the home page that says View Available Proposals, and you'll click View Opportunities. From there, you'll see the 3 different community grant RFAs. Make sure you pick the right one for your region. So here's the regions again. The CG application 2017 is the RFA A for Mid-Michigan. It might not display correctly in GEMS that is A. So just make a note of that if you're Mid-Michigan. So once you find your correct opportunity, right below it, click the Apply Now button. GEMS is going to make sure that you're serious about initiating an application, so go ahead and click the I agree button on the next page that pops up. Now, once you've initiated an application, it's going to open up to the application menu. It's going to open up to the different forms and pages of the application itself. So immediately you can start filling in information. But as any good grant writer, you're probably going to come back to this in a later date to review it again. So to find an application that you have already started, you're going to search under the My CG Applications tab. You'll see that outlined in the red box on this image on the screen. To find this year's application, you'll search for 2017, either the blank, B, or C, depending on your service area. To find a prior year application or report, if you're a prior grantee and want to look at those things, search in the correct profile. In the drop down on My CG applications, you'll see that there's, for instance, three 2015 applications. In the parenthetical at the end of that application, you'll see a different code, MI100, MI102, and MI101. Those correspond to the different service areas. So here's your code for how to tell the difference. So for example, a 2016 Southwest application would be 2016 CG application MI102. If you have any trouble with this, please just let me know. I'll try and create a little cheat sheet for former grantees for how to find your documents. So here is the application menu. This is what your actual application page looks like. We'll talk briefly about each of these four elements on the page. The first is the View, Edit, and Complete Forms button. That's where you're going to do the bulk of your work. That's where all the different forms are, all the different pages of the application. The second option there is Change the Status. This is where you and the authorized signer will actually move the application through the submittal process. So the project director will change the status to Authorized Signature Required for Submission, and then the authorized signer will log on and will change the status to Submitted. So that's the Change Status section. The next section is Access Management Tools. I often like to get a final copy of an application as submitted for my records. So this is a place that you can click there. The first option is Print Full Application, and it'll spit out a PDF into your browser. The second option is Print a Blank Application. So for instance, if you want to handwrite some of the application elements before you type them up, you can print out a blank application that way so that you can see all the different parts of it. That's also where you can add and delete people to the document. So for instance, if your authorized signer changed and you have a new authorized signer who registers and you approve them, this is how you add them to documents that existed prior to their approval. You'll click this open, click the Add Edit People, search for their first or last name, click the box next to it, and click Add. The Examine Related Items at the bottom is where you initiate a report, and I think that actually got changed recently to read Initiate a Report, which makes more sense, doesn't it? So that's your application menu. The shortcut to come back to this page, you see at the top of this little image here where it says Document Information, and then it has a blue hyperlink, CGA 2011 Komen. That's a hyperlink, and anytime you see that at the top or bottom of a page, if you click it, it'll bring you back to the application menu. So there's a little navigation trick for you. When you open up that first option, the View Forms page, this is the different pages of the application. So you'll go through and open each of these as you fill out the application. Some of them might be worded a little bit differently than this screenshot. As you go through on the left-hand column there, you'll see that there's pages. Every time there's a page, that's something that you can fill out and change. If there's a different icon, it means that it's a summary. So for instance, the project work plan summary right in the middle of the page there, that actually pulls your goals and objectives together into a single form. Similarly with your project budget summary, the pages, salaries, consultants, supplies, travel, etc., all pull into the budget summary. And then on the budget summary page itself, you have the option to show your in-kind support and your other support for your program. Our grant reviewers love to see when you have other support for the program to show that this is a collaborative effort and that you're not relying solely on one funding source. So make sure to include some of that information as well. Each of those pages also has the opportunity for you to provide more information and justification, and the project budget summary page itself has justification, a justification box there too. So we've gone through the different elements in the GEMS system. I want to give you some important reminders. GEMS is finicky. It will log you out within 3 minutes if you don't catch that little warning box. If you haven't touched your computer in somewhere between 20 and 30 minutes, GEMS will automatically log you out. If you didn't hit save, nothing will be saved. So I often encourage folks to just draft in Word. Grab the different sections of the application, draft in Word, do your editing, do your word checking, do all of that in Word where you can save a backup copy. And honestly, I like editing there better. And then you can go into GEMS and copy and paste. Always hit the save button before leaving a page. Even if you're active and you're navigating between things, you'll lose the information on the page if you don't hit save. Utilize your navigation links in the browser. I strongly encourage you to use Chrome. Internet Explorer in the past has not worked well, so Chrome is a good option. I think Safari works just fine too. Whenever you have a question, check back to the RFA. It's a really long document. I know it's very detailed and it has a lot of really important information for you to consider as you're going through your application. But if the RFA doesn't have it or if you're confused about different elements, please give me a call, send me an email. I'm happy to help. To submit the application, the project director has to change the status to authorized signature required, and then the authorized signer has to sign on, finalize the submission, and change it to application submitted. It's a two-step process, and that it should be pretty well outlined in the user guides available on the website. So, application submission, we'll go through this really quick. On this page, you can click on My Tasks and open up the application that way, or you can go up to the My CG Applications tab and search for the 2017 app for your region. Open up the application menu, and that second option that we looked at is Change the Status. So open up the View Status options, and you'll see these options. Hit the Apply Status button underneath the correct status. If you accidentally cancel your application, please call me immediately and I'll back that up for you so that you can continue working. And then once you do the authorized signature required, then the authorized signer logs on, opens up the application, opens up the status options, and clicks Submit. And the unofficial status, of course, is a happy dance. So with that, do we have any questions? I will check this little question box next to me. The little chat box if anyone has questions. And actually, I might unmute you if I can figure out how. Yep, right here. Okay, so everyone should be able to unmute yourself and talk now if anyone has questions. Otherwise, feel free to type them in the box. Okay. Well, hearing no questions, I think we're going to wrap this up. If you do have any questions, please feel free to email me. We'll figure out a way to get those all up on the website for any pertinent information that folks would need. Thank you again for your time. We really look forward to reviewing your programs and look forward to working with you in the coming year. Thank you very much. Take care.